Hello and welcome to our presentation about nursing at Mayo Clinic. We will touch on a few facts about Mayo Clinic as a whole as it pertains to nursing and go over some frequently asked questions as well. My name is Emily Corey. I'm one of our HR recruiters, and I'm joined with a couple colleagues today.
Hello, everyone. My name is Eric Felsen, and I work in the cardiac surgery transplant ICU, and I'm a staff nurse recruiter.
And my name is Jeff Eigen here. I'm an HR recruiter here at Mayo Clinic. I think the first slide is going to go right back to Emily.
So this is just an overview on our locations across the United States. I'll let you read the facts about each location on the bottom of this screen, but a few things to note. Mayo Clinic is the #1 hospital in the nation, and that is our Rochester, Minnesota campus. We also have hospitals in Arizona and Florida. Both are #1 in their respective states as well. So something we're very proud of. And then we also have our Mayo Clinic health system. And these are our critical access locations across southern Minnesota and western Wisconsin.
I'm going to take the opportunity here to talk about some of our benefits. I feel very confident with our competitive salary approach. We have a great compensation team that does yearly analysis or yearly reviews of our wages. Then the next bullet does talk about our insurance packages. One of the exciting and maybe connects to the non-monetary below is that our insurance is provided by Mayo Clinic staff. So great health insurance and dental package or dental assistance to go with that. I personally have a great appreciation for our employer contribution towards our benefit plans. We have a pension plan as well as a match for our 403B, 401k where it's applicable, but mainly for our hospital staff, a 403B plan. We do have a relocation assistance benefit as well. So for those of you who are relocating more than 70 miles away will qualify for assistance. It is a tiered approach. So the further you're moving, the more support you do get. The last one I want to touch on real quick for a monetary approach would be our career investment program. So easy example is somebody who is an associate's degree prepared RN will be required to obtain their bachelor's degree. And with that expectation will come financial support. Mayo Clinic will help you achieve that. Same though for any of our graduate level programs, such as a master's in nursing or even our APRN type of roles like a CRNA or nurse practitioner. Mayo Clinic is consistently looking at our needs and often has the opportunity or the benefit to help you with your financial obligations when achieving those degrees. The next slide is going to be more nursing specific, so I'll pass it off to Eric.
So as we've already talked about, Mayo Clinic is the #1 hospital in the world for several years running. We are also a magnet recognized organization. The Rochester campus has actually been redesignated 6 times. Less than 1% of magnet hospitals can claim that redesignation process. Our Arizona and Florida campuses are also magnet designated respectfully. As a bedside nurse at Mayo Clinic, some of the characteristics that we exhibit to our patients are caring healer, teacher, navigator, and problem solver. These characteristics and attributes of each bedside nurse are definitely observable at the bedside with our patients, with our collaborative teams that we work with, and for those family members and other caregivers for the patients that we provide care for. At the bedside, we work in a very team effort. The nurses' input is valued by the providers that take care of the patients. We are able to participate as nurses in a shared decision making model, which is a characteristic of Magnet, both at the unit, departmental, and organizational level. Those are open opportunities available for all nurses. Depending on your unit, they do have coordinating councils that allow each unit to make their own kind of personal family attributes for those different specialty units. We also are able, as bedside nurses, to participate in evidence-based practice, helping it to change and modify our care model, as well as different policies and procedures on our units and as a hospital altogether. We are also able to participate in new technology implementation, be it in the ICU or out on the general care floors, as a means of reducing pressure ulcers, or working with different technology groups to integrate into our electronic health record. Nurse orientation is built around a tiered skilled acquisition model. This acquisition model it takes into account your experiences and your training previous to coming to Mayo Clinic. Depending on what unit you come to, be it a general care, a progressive care unit, or an ICU, your length of time for your orientation will be modified based on, again, your previous knowledge, as well as the knowledge that is needed in order to practice safely independently. You'll be paired with a preceptor, and those characteristics will be used to get you through to that independent care. And then our nurse residency is part of your new grad orientation, but it is a 12-month long program that is automatically, you are enrolled in it as a new grad nurse. It does vary from Rochester, Florida, the health systems, and Arizona as far as the involvement. But it's a time where you get integrated with your fellow peers that are also new grads to learn about life skills, transitioning to that professional nurse model, and becoming more familiar with the resources and the access to continue your education with Mayo Clinic. This video link you can find in the notes below.
This page highlights some of the nurse internships and opportunities that are available as a student nurse. If you would like to get your feet wet with some bedside experience prior to graduation. So we do have the Summer 3 internship specific to Rochester. We have a nurse tech program. This is traditionally offered after your junior year as a BSN student or your third semester as an ADN student. And then we do have PCA opportunities across all of our campuses where you would actually be working and assisting with direct patient care.
Wrapping up our presentation today with some frequently asked questions. One common one would be, what specialties or work areas accept new grads? Excitingly, at Mayo Clinic, we'll consider new grads in almost all of our specialties in settings. So even our ICUs, we'll encourage you to apply. And if you do look closely at the job postings itself under the qualifications, it will specify student versus experienced nurse as a requirement. But again, most of our ICUs and progressive care units will consider new grads.
Another big frequently asked question, when should I apply? This varies again across our campuses and depending on the program you're applying to. Typically a good time, a good suggestion, we say is about 3 months prior to graduation. So you definitely want to go ahead and apply before you graduate. But just like Jeff mentioned, the postings will give you any specifics that you need to know about that particular residency or program. And I especially like to point out for our Arizona new graduate nurse residency, they do only open applications 2 times a year, typically in the spring and the fall.
Sort of rolling right off of the when to apply, it's what's the application and the interview process like. I mean, short and sweet, we do video conference interviews in almost all situations or as often as possible. So just to maybe even do the next bullet, a timeline between all of that is that you would apply 3 months prior to graduation. Commonly, an interview could be done, set up again virtually within a week or two of that. And then in most situations, nurse managers are going to be able to move through the process within a week or two after that. So quick time frame would be about 30 days is when you could apply or should apply and then hear a response. Again, it is very situational. We have many different settings throughout the enterprise, and each manager and nursing leadership team, I would say, navigate through that process a little bit differently. The interview process itself is going to be based off of a behavioral-based interview question. So you'll be asked a few of those along the way, and would encourage you to prepare for those the best that you can.
What are preferred qualifications or ways to stand out on an application? So coming in as a new graduate nurse, you will definitely want to highlight your clinical rotations and include how many clinical hours you spent for each of those. If you're applying to a specialty such as the ICU, so for critical care, they definitely look for previous critical care experience. You'll want to make sure that that's on your application. Other ways to stand out on your application would be any hands-on patient care experience that you've had, any customer service, work experience, cover letters, letters of recommendation, anything that you want to add to highlight yourself and why you would be a great fit at Mayo Clinic.
The last bullet here does say, what should you look for when searching for a position? So our careers webpage is relatively resourceful, and I'm going to encourage you to search through that based off of the site and location. And then when you are applying, make sure that you're looking at the job posting details, such as the shift rotation and the expectations that come with it. On this page here is our Mayo Clinic newsletter connection resource. So a link or a QR code bringing you to the same place. The newsletter is sent out monthly, and it's a great opportunity and a relatively easy way to stay connected with us here at Mayo Clinic. The next slide is going to talk about some resources for you. As there are links, I'll just highlight the very top email address, placement@mayo.edu. It's a shared inbox that's monitored by many nurses and a couple of us on the HR or admin side. Any sort of questions that you have in regards to nursing opportunities at Mayo Clinic, really the best place to go to have those, again, triaged and taken care of. I think the next two slides are going to wrap it up with some questions and thank you. So we'll wrap up here and look forward to hearing from you and wish you guys the best.